Welcome back, amigos, and here we are talking with Dr. Eudene Harris from Oasis for Optimal Health, and we thank you for being here.
Thank you for inviting me.
It's a very important topic today that we're going to be discussing, because I think the terminology that we use at the beginning, it's the secret of the better well-being for our community. What is that? What is the combination between a traditional medicine and the natural medicine, doctor?
Well, Carlos, I'm traditionally trained. I'm a medical doctor, trained as a medical doctor. As they say, grew up as a medical doctor. What I'm trying to accomplish now is to help us not to forget the basics about health, because we're really dealing about health. We know a lot about illnesses, and I think as a general rule, we're looking at our population, we're getting more obese, we're increasing our risk of insulin, dependent and independent diabetes, type 2 and type 1 diabetes. We're having all these issues going on, and I think for me what it forces me to do is to go back to the basics of health, which for me is nutrition. So that's primarily what I tend to focus on in my practice. And people will say, well, do you do weight loss? Do you treat diabetes? Do you do any of those things? And the answer is in any illness, any diagnosed illness or pathology or ill health, you ultimately have to have proper nutrition. So I say, yes, I would address all of those things. I allow your primary care physician to take care of you with all of those things, but I am the supportive part of that.
Do you know that how many times people have think about like why people in the past they last so long, and obviously because the food that they were eating, they were like natural food, straight from the root. So it's something like that where you're trying like to bring back to our era.
Yes, it's something like that. I actually heard an interesting statistic actually today, and it basically stated that we are the first generation that have a life expectancy shorter than our parents.
Wow.
Now that is something to think about. So when we talk about nutrition and integrating that and health, I hear from a lot of people, well, I already know about that. I already know how to eat well. I already know all of those things. But knowing it and doing it tends to be two different things. For example, I know about tennis. I know about the rules of tennis. Put me on the tennis court, however, I'm not so good at that.
That's a very good point. And you know that it's very aligned with what we're living with people that want to quit smoking. Everybody knows that smoke kills people every day. 1,200 people every day in the United States of America, and many people still smoking. And that happened as well with the nutrition.
Yes.
But what we can do in order like to move forward, like to make the breakthrough and become someone who care about what we eat?
Well, education, I think, is the most important thing here, because I think most of us think that in order to be healthy, we have to reduce our caloric intake and increase our activity levels, and that usually helps us to lose weight and to be healthier. But what we're not aware of is that all calories are not equal. All calories are not equal. You can have somebody who, for example, eats 1,400 calories a day, and their diet is primarily high carbohydrates, refined carbohydrates, sugars, and donuts in 1,200 calories, and you have someone else eating 1,200, same amount of calories, but they're eating lean meats, and they're eating fish, and they're eating lots of vegetables, and those are carbs as well, and you would find that the person eating those 1,200 calories will tend to lose weight.
So it's not as easy as reading the label.
It's not as easy as
deeper.
It's something deeper than that. And the important thing, I think an easy rule of thumb, if it's just whole grain and it's not been processed, it's probably better for you than something that has.
Let's do a commercial break, friends. So we'll be right back after this message with Dr. Harris. Stay tuned.